again. We're gonna do another question on the internet. Up here in Massachusetts lately, it's been raining a lot. A lot of rain. So hopefully you guys are staying nice and dry. I'm trying. Although I just went for a long, hour-long walk, so I got a little wet. It's fine, though. It's fine. Okay. I found a really complicated question on Reddit. Let's go over it. Okay, there we go. This is a big one. So this is a big question. This is going to be another one of those episodes where we only do one question because of how long this is, but I thought it was quite interesting. Not chiro specific, but guess what? It's an our back pain. Who'd have thought we'd talk about that? This one popped up in my, I got this as an email, actually. I just thought it was super interesting. This one, yeah, it'll probably be like a scrolling thing because of how big it is. We'll see. It's very big. It's very, very big. Okay, so here we go. Living with a big L5-S1 herniation and finally fixing all the pain from it. This would be a slightly longer post that will show you how I managed to get from basically an invalid state where I could not walk without help to someone that now can live absolutely pain-free doing everything day to day. I would like to hope that I might help somebody with the info and they get better at the end. As a bonus, I will post the before and after MRT image directly showing the issue and its state. As a start, my L5-S1 herniation was caused by an accident. So it was basically an abrupt injury, which immediately rendered me in excruciating pain, not being able to stand up properly or even walk on my own. The condition had pretty severe symptoms, which I started to manage with ibuprofen pills all day, every day. It helped a bit, but I was still not able to do basic daily tasks, let alone live a normal life. The pain I had was both centralized to the waist, combined with a gnarly sciatica on the right leg, a nightmare combination. Okay, so I'm going to kind of slowly peel open the onion as we go. So if you're having an abrupt injury like that, my guess would be he's probably, again, I say he, I'm going to say he, generically speaking. I don't think I saw anything in here that indicated that it might be a lady. The location of it is obviously super important. They know it's an L5-S1, so generally speaking, that's as far down the low back as it tends to go. That is a very common place for things like a sciatica to manifest, so that all checks out. Obviously, it'd be good to know what the exact accident was just to kind of understand the mechanism, but if I had to take a lucky guess at it, where the location is and all that, he was either bending over to pick something up and he went up too fast or something like that. He got hit in the back by something fairly directly. Usually that doesn't cause necessarily a disc bulge, but obviously it's not comfortable, and that could be potentially what it is. Or he could have like fell on his like butt and like landed on his glutes, and if you hit it hard enough, that can cause a disc bulge. Or it might be a case of he was like trying to pick something up improperly, and again, kind of like a bending at the waist without proper core engagement and all that can cause that kind of stuff too. Obviously he didn't say any of that specifically, but I figured I would kind of go over that real quick. That's usually the kind of traumas that can happen that cause disc bulgy sciatica type symptoms. Started going from doctor to doctor, highly regarded neurosurgeons in my area to get opinions, and all of them basically said the same thing. The condition requires immediate surgery or else I am risking permanent nerve damage, which basically means issues for life. No alternative options were given or discussed, as every doctor said the condition was way too serious. However, I was hesitant since I have friends that have undergone such surgeries, and a few of them needed surgery on the same place a few years down the line. I have a friend with 3 surgeries on the same disc, but you can only cut so much of it until the discectomy is not really possible anymore. Again, we talked about this, I think, in the last episode. Yeah, sometimes when you go in, and again, I'm not a surgeon, so I cannot tell you, I'm not allowed to tell you if you should or should not get a surgery, but I will say if you look at the research for it, there's a lot of cases where if you get surgery in the low back, inevitably there will be another one because of the changes in biomechanics. It's not necessarily the surgery that does it in a way where you have to it's not like if you get a surgery, you are destined to get another surgery. That's not the case, obviously, but there is a strong predilection. There's a significant amount of data out there that suggests that if you go down there and cut something out, the changes in the biomechanics will cause something else to want to not move properly. And scar tissue will never fully get to exactly where your body was before. So if you have a scar on your disc, it will always be at least so slightly weaker than if you didn't have a scar in a disc. And if you think about it like that, you can get it real close. You could probably get it to like 99.9, but it's not possible for a scar to be as strong as your, I say the word God-given, first set of whatever, right? I'm sure you could replace it with like titanium or whatever, but you figure when you do something like that, there's a lot of other repercussions for it. But when the body naturally heals something on its own, it will never be perfectly as strong as it was before. And generally speaking, that's why when you get injuries into like the knee or whatever, there will always be like a little bit of like a predilection for like you get knee pain maybe a little bit more frequently since you injured it before, because scar tissue doesn't fully heal as well as like your natural set. But you can get it really, really close, and if you stay on top of it, you could very easily live your entire life without ever noticing that it was ever a problem. You just got to stay on top of it it. I like to think of it as knowledge is power. If you know something's wrong with that area and you just stay on top of it, generally speaking, it's not a problem. You may completely forget it even happened. And then you have to write down like your medical history. And you're like, oh yeah, that's right. I forgot I had a knee surgery back in blah, blah, blah. So anyway, the point I'm getting to is there is a lot of data out there that says that if you do go for the surgery, if it's necessary, go for it. 100%. If you feel like it is 100% certain that it is something you want to do, I say go for it. I always recommend, again, I'm a little biased, obviously. I always recommend you at least try some kind of conservative care before you do it, because everybody's always a little bit different. Some people will recover way easier than others. There's genetic factors in effect here. There's a lot of lifestyle type stuff. We obviously can't get a perfect set of data from a Reddit post, so there's a lot between the lines here we can't necessarily get to. Like maybe this person is a professional athlete and they have a really good set of genes where they just happen to heal way better than most other people. That's just something you can't really account for. That's just something that happens, right? So that's why I always say conservative care is always the best. And when you're doing conservative care, you should be engaging with the doctors as you're doing it. And you should be doing as much as you can in the lifestyle and while you're at home factors so that you can manage to get to the healing process a lot quicker than you would otherwise, right? As we continue. Meanwhile, the pain got worse. Symptoms were not going away and I just had to take a few steroid shots just to get by. This is a few weeks into the problem, seeing that just the NSAIDs, ibuprofen in my case, can't manage the pain anymore. The steroid injection managed to actually numb most of the pain, which was a miracle in its own honesty. Also, that's also something that people are always, I think, hesitant to talk to me about like getting Botox injections and other kinds of like pain injections because they think I'm going to judge them. Listen, I'm going to break the mold here and I'm going to tell you something that I've realized as I've been on this earth. Pain sucks. Pain is not fun to deal with. If you need to get an injection to maintain your I was gonna say your sanity, but your sanity. Go for it. I won't say no. I don't think it's a bad idea at all. If you're in mind-numbing pain 24/7, that will absolutely ruin a human being. And go get that stuff if you think it's warranted. And the surgery or the surgeon or whoever's doing the injection, I think that's changed a little bit since I've been around. Who can do what injections and all that, and I admit it's difficult to keep track of. But if there's somebody out there saying that they can give you this shot and it helps you get through some of the healing process, I say go for it. There's definitely no backlash from me. Anything that manages to get you out of pain for a little while, it really helps you make some of the lifestyle changes and it helps you move in order to heal it. Because if you can't move at all, your healing is going to really, really slow down. Proper movement is super key. I have a feeling that this is probably going to go in that direction based on the fact that the person got better. I haven't read ahead of this. I looked at the MRI just a tiny bit just to see what we were getting into. I have a feeling it's about to go in that direction, so let's keep going. But anyway, the point I'm getting to is if you need a shot and all that, there's no judgment from me. Any chiro that judges you harshly on that, they don't understand how much pain some people can be in. I truly think it could be just as bad as like the surgeon who only recommends surgery if they don't ever like see the other side of the coin. That's my opinion anyway. Sorry to say. Now, this is the key moment into my story, and I want to press on it. I used the steroid injection not as a pain suppressor, but as a tool to start the recovery on my own terms. Boom, baby. That's exactly what those shots are for. By that point, I already had read half the internet of articles, subreddits, etc. for info and hatched a plan. Yes, a plan. Yes, I love plans, yes. Get the steroid shots and try to follow a non-invasive protocol before giving up and going for the surgery. Couldn't have said it better myself. At least I would have known that I had done every alternative that I could, and there is just no other way. This person is a person after my heart. Man, if I knew this person in real life, I'd give him so many handshakes. So many handshakes. The protocol I started was actually the simple and always discussed McGill one. There it is again. I still haven't read that book. I really should order. You know what? I think I'm going to order it here pretty soon and just read it and then just talk and just do an entire episode on it. That's got to be something I do with how many times we read that comment. I got the book, read it twice, made every test there on myself, noted everything on a piece of paper, and started strictly following the guidelines there. Extreme back hygiene, the big 3 exercises, nerve flossing, and walking. And walking was still, well, very hard. At the start, I could walk maybe a minute without the pain coming back. Then a week later, I could maybe walk 30 seconds more, and then maybe 2 minutes, day by day, week by week. Slowly, I could walk more and more without experiencing huge amounts of pain, just so I could stick to the routine. I was just walking around in the house, not even going out, but I did it every day, as many times during the week as needed, until I got at least an hour of walking into every day. Hell yeah. Hell yeah, brother. I love that. God, I love hearing that. Some days will hurt more, some days will hurt less. What I learned is that every day is different and setbacks are just part of the process. You could not lose hope when it happens. It is just a part of the game. Slowly but surely, 3 to 4 months into the protocol, I was off NSAIDs almost completely, and while I did still experience pain, it was manageable. Also, here's something that I think some people don't really realize. When you have like the concept of like the good and bad day, having a bad day is not necessarily a bad day. It's kind of like what they say in Wreck-It Ralph. I'm a bad guy, but I'm not necessarily a bad guy. I don't know why that came to me. What can happen is if you have a bad day, the increase in pain that you're feeling, it may not necessarily be something that you did or your fault or some other kind of like negative. What it could be is that your body is focus healing on something. And in order for you to heal, your body has to have the same things in it that cause you to feel pain. So in some ways, having a day where you have more pain there, while not necessarily fun, it might actually be a good indication that the body's really paying attention to what's going there. And it's not necessarily a bad thing. It could actually be going through like a bit of a healing sprint, I guess might be a way to put it. Why are people messaging me? Don't they know I'm at work? But anyway, yeah, so that's actually not necessarily always a bad thing when you have a bad day. I like to think of it as if you start to have more good days than bad days, that means the bad days are probably serving a purpose, especially if you don't tell me that like, oh yeah, I sat in my office for 12 hours straight and then my back hurts. Like that's different, right? Because if you're sitting and you're doing something that the back doesn't like and you have more pain the next day, that's different than just saying, oh yeah, I went for a walk and then, the next day I was kind of in pain, blah, blah. So there's a lot of like nuance to it is the point I'm getting to. The sciatica pain started going away, and while it was a good thing, I had a very bad realization at the same moment. Where the sciatica pain was before, now the area had almost no sensitivity to the touch. The place was almost completely numb, which honestly scared me a lot of the time. It looked like permanent nerve damage was already in place, and I was not sure if I should continue with the protocol or go for the surgery at this point. At this point, I decided to gamble again and keep doing what I was doing, and maybe 1.5 to 2 months later, I finally felt some sensation coming back to the area, which was a huge relief. Okay, so quick note, nerves are the slowest healing tissue in the body. A lot of people say that they don't heal. There is a lot, there's something to be said about that. There's like research that kind of goes both ways on that one. I will say that the nervous system, the brain especially, what they call like neuroplasticity, the brain is really good at kind of, that's the idea of like taking over areas that aren't being used to increase the efficiency of areas that are being used. I was like, so the idea is that if you go, let's just say you go blind, there's a part of your brain that controls your vision. Well, if it's not being used for vision, your body will turn it into something else that you are using pretty consistently, which is why sometimes when people, a lot of time, if somebody goes blind, their hearing gets better. Then you become Daredevil. And when you're Matt Murdock, you could throw sticks and bounce it off of stuff and ping people in the head. I'm a bit of a Daredevil fan myself. Anyway, but his superpower is super senses, by the way. Anybody here who's not a Marvel fan. Anyway, but you figure if you are able to do that with the brain, the nerves and all that, they will slowly heal. Nerves that are not necessarily in the brain. The brain, like I said, there's definitely some argument to be said on if you lose it, you do lose it for good. I'm not the one to fully make the judgment call on that. Obviously, research has some ways to go, but their nerves can heal. I will say nerves totally can heal. There have been situations where even a nerve ablation, which is where they take a red hot poker and they just burn the nerve until it literally dies. The body will regrow the nerve because it wants the nerve to be there. And you're having an argument with your body that is probably good maybe in the short term to help you with pain, but the hope is that you'll use that change to make better choices to improve your healing or whatever, right? And obviously there's a lot of like different, unique situations and conditions that these things apply to. Just kind of throwing that out there, of course, but just know that if you do lose feeling in a certain area, there's always a chance that it will regrow and you could get the sensation back. They call that a cutaneous nerve, which is the nerve that innervates the skin, and and when you think of like touching your skin, that's the nerve that does that, and they can regrow. It just takes a long time. I'll have to talk about the story about blue M&Ms at some point, but look up blue M&Ms and nerve healing. It's pretty funny, actually. Since I used to go to the gym before the injury, note this was not a gym-related injury, a gym-related injury. Yeah, right. Yeah, okay, that's good to know. I was specific, so he probably wasn't doing like a deadlift or anything, or a death lift. Death lifts for life. One day I decided to go there and just do some really light exercises. What I noticed was that doing pull downs, see this is what I like to read right here, or similar movements actually gave me a bit of relief. So anything where you go down. So it probably involves core. Pull downs usually require some kind of core, is my guess as of right now. Likely because of some stretching happening in the spine, I started going every day just to do this stretching and get some relief. Heck yeah. Slowly but surely, things kept improving. I still had setbacks, but they were less and less painful and rare. Now, 10 and 11 months post-injury, I'm basically almost free of any pain. The most I feel is slight centralized discomfort if I somehow load myself too much, lifting something way too heavy or not properly. Shock there. The sciatica is completely gone, and the numb area is now 100% recovered as well. Here are the promised MRT images. I'll probably put them up. Bing. Hey, there's number one. And then the second one is 11 months after the first one. Bing. There's the other one. Man, I'm so good at this. Thanks, do it in post, Dr. D. I really appreciate it, man. You're always there. You got my back. That's a chiro joke. What you will observe is that the herniation is notably smaller and not pressing on the nerves as I did in the beginning. The doctor that did the second MRT came to me after comparing before and after and asked how did I manage to get the effect without any physio or surgery. The guy was genuinely very surprised, basically could not believe that the herniation got smaller by itself. It didn't get smaller by itself. The guy put the work in. there's a lot. I hope my eyes played an entire conversation in itself, and I'm just going to leave it right there. By writing all the above, I just want to show to people that are in a bad place that there is almost always hope. Observe your symptoms, think logically, and try everything you think makes sense to you. But if you decide to try, do it 101% and don't skip on anything. You might need to be your own doctor at times, but it could very well be for your own good. Boom. Love it. That is a fantastic story. Absolutely super happy for you. This is a perfect example of where patient empowerment can make a huge difference. And again, I'm going to say that there's a lot of different people in this world that all have different strengths and weaknesses. And, that's the beautiful thing about being a human, is that we're all really good at certain things and sometimes we're really bad at other things. And the thing that I will tell you right now is that there is a certain kind of patient, especially if you come into chiro, because a lot of what he just talked about, there's a lot of I guess you call it like a chiropractic principle, where I've always believed that if you have a patient who knows what's happening, a little bit of patient education can do absolute wonders. And if you tell somebody what's wrong, there's going to be some patients out there who want to understand. They want to be able to stop it from happening again. They want to learn the lesson that their body's trying to teach them. And is everybody going to be that patient? No, absolutely not. I would say the majority of the patients that come in, they couldn't give two rats poopies about why they're in pain. They just don't want to be in pain, and they don't really want to make a lot of changes for it. That's why they're going to the chiro, because they want the funny man to crunch and crack and make the pain go away so that they could go back to doing whatever it is they're doing. They want to go to their bowling league or take care of their grandkid or sit at their desk and pay their bills and blah, 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 whatever. And both of those people are just as interesting, just need just the same amount of validation, and they should be treated equally in regards to where they are on that whole chart. Do I get judgy if somebody comes in here and they have no interest in learning about chiropractic principles to help them stop having their pain from 20 years down the line? No, I do not care. If you come here, I will meet you where you're at, and I think that any medical professional who is not willing to do that is missing the point of what it is we are doing here. You got to be a people person if you want to be one of the best medical people in the entire world. Like when you watch TV shows and all that stuff, House is a good example. House is not really a very good people person. In fact, he's quite the opposite. He's actually kind of nasty, but he's really, really smart, and he knows these rare diseases that people probably wouldn't really have in those situations. It's TV show, so it's obviously a little bit different. But if you look at his situation, generally speaking, when you really boil down what House is doing, he has people's best interest in mind. He may go about it a little bit weird, and he might have a lot of gruff exterior that you got to get through, but generally speaking, he has the patient's best interest in mind, and it's not like he really needs money. I don't think. I watched a whole lot of that show, and there's never an episode where he's like, I can't pay my bills or whatever. And so you figure when you come at it from that perspective, where you have the person's best interest in mind, if the person is at the point of their healing journey where they say, hey, I want you to tell me literally everything about this so that I can kind of fix it on my own, and I need you to crack my back, and then when you come in, we'll talk about it and how certain things have improved. While I was at CrossFit, I was doing my squats, and I notice it when I do maybe I'm overcompensating on one side over the other, blah, 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 whatever. That's a completely different conversation than when you have somebody who comes in who works at a desk, and maybe let's just say it's a single mom who works a lot because they're trying to pay the bills, but they also got to take care of their kid, and they don't really have a lot of time to go they can't get to the gym because they don't have access to anybody who can help them with their family, blah, 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 blah. That's a completely different conversation, because if that's the case, sometimes when people come in here, I say, what's going on? And I try and figure out, was there a specific thing that's causing this kind of situation? They say, oh, my back hurts because of I have extra stress while at work. That's a very common one. And I say, okay, well, what's causing the stress? Because again, when you think about the three-legged stool of healing, at least for chiropractic, what I call the triangle of care, not me specifically, but that's what I like to call it, regardless, whatever. I'm gonna get really into pedanticness on that. So if somebody comes in and they say, yeah, stress is my main factor, and I say, well, what's causing that stress? And they say, well, work is causing that stress. Dive in a little deeper. Find them. To be interesting, you got to be interested, as I like to say. And if you don't figure out what it is that's causing that stress, I don't think you can truly fully manipulate it in a way to where it gets better, right? So in this case, I have a specific person in mind. They come in and they say, hey, I've got a lot of extra stress at work because of my coworkers are sick. One of them got injured, and another one's on maternity leave or whatever, right? So now I have to work a lot more because people are sick or they're not there, blah, blah, whatever. And she says that there's really nothing I can do about it, and that's okay, because hopefully, that at the end of whatever period of time that is, eventually the coworkers will come back. The workload will be reduced, hopefully. And when that happens, that the thing that's causing their extra level of disease, as chiropractic philosophy likes to call it, will decrease. And that means we're just trying to play keep away. right? We're just essentially just playing guard in order to maintain them at a certain level of survivability, is some way to put it, where they know that by the end of, like, let's just say a month or two, they'll be back to kind of where they were before, and maybe they come in once a month or whatever. But if they're having a lot of extra stress and they're getting the same weird symptom that they don't like dealing with every week, well, then you say, okay, we'll come in every week, we'll crunch it, snap it, we'll talk about it. And if they walk away feeling great, then great. That's mission success. But not every situation that require, like when you're educating a patient, requires tons of massive changes in lifestyle and all that. Sometimes it's just talking to somebody who tells you, it's like, listen, you're gonna be fine. There's nothing here that really scares me. It shouldn't scare you. Let's just get through it. But in this kind of situation where it's like more of like a physical thing, this person went to neurosurgeons and all that, and and from what I can understand, again, I don't know this whole situation. I can't say who is and isn't the bad guy, or I doubt that there is a good or a bad guy in this situation, quite honestly. But you figure if they are going to a neurosurgeon, the neurosurgeon, as I like to say, they are paid to surgeon. They are paid to cut you open and do stuff. So as soon as a surgeon, in my mind, or anybody, quite honestly, if you go to a medical professional or even a plumber, go to a plumber, right? Let's take medical out of this, because there's a lot of emotion in medical, because people, when people are in pain, they're grouchy, and there's a lot of like money, blah, 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 blah. So let's look at it from a different perspective. Let's say you go to a plumber, right? And you say, hey, my sink isn't working right. You go to the plumber and you're like, can you fix my faucet? Why does it not work? And they look it over and they say, okay, all the seals on the faucet's great. The pipe itself is not blocked, blah, blah, blah. But maybe there's a problem with your the water pressure. I want to say the radiator. I forget. This is maybe not a great example, but the actual like the tank where the water has to come through in order to like get into the actual faucet itself. Is that necessarily that person's job? Maybe they don't specialize in that kind of stuff. But as soon as somebody says to me, hey, instead of like taking them for a ride and saying like, oh yeah, I'm gonna fix every pipe in your faucet because like maybe that's the problem, but they don't know for certain, and then they fix all the pipes and all that, and then it doesn't actually fix the problem, and then you're just like, well, okay, I just paid this guy to fix the pipes. Why didn't it change? Well, they're like, well, who knows? Your house is cursed. It's haunted by ghosts. And that's the kind of conversation you can have with certain medical professionals, because like they say, do this, 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 and this, and then it'll all go away. But what happens if it doesn't, right? And so I think that it's really important for medical people to keep their minds open, because if you come in and you try this thing and it doesn't get better, well, then what is the next step? And you can't tell them with utmost certainty. They're like, if you just do these 3 easy steps, everything's going to completely go away, because unfortunately that's very seductive, right? Is if you go to somebody and they say, hey, I got the cure for what ails you, and if it doesn't work, then you're more devastated, because you're like, well, I believed in you, and now I start to have trust issues, or blah blah blah. Kind of going on a rant here, but regardless, this person went to neurosurgeons and they said, well, you're doomed if you don't do this. You're dead in the water. You're gonna just wander listlessly through life if you don't let us surgerize you literally right now. It's kind of what they were saying. Again, this is through the filter of a patient who might be dramatizing it. Maybe that's not exactly what they said. I love surgeons and I love PTs and all that stuff. I think that they usually have people's best interest in mind, but it's always good for me anyway, to think about it through the lens of where does the money go? And that's always something that I want to say you think about, right? And so in this situation, they're saying, if we don't surgerize you, you're gonna have permanent nerve problems, blah, blah, blah. And then this person has friends who have gone through similar situations where they would have to get surgeries later or whatever, blah, blah, blah. That's obviously like a really important, I don't want to say socioeconomic, but there's definitely like a social aspect to that, where they're like, okay, well, this person's now is using fear to try and control what I'm doing. Maybe. Again, I don't know the surgeon, and I wasn't there for the exact conversation. But to me, it sounds like they're kind of using like some fear tactics to be like, if you don't do this, you're doomed. Why didn't they recommend PT? Well, I know why they don't recommend chiro, for a variety of reasons. But, why didn't they at least say, hey, try a conservative care, spout, a bout of treatment to just see what happens. If you get better, well, then maybe you don't need the surgery. But if you do a treatment of care while, through more like conservative means, I would be much more certain myself, if I needed the surgery, to go through the surgery if you feel like there really is no other way to deal with it. There's nothing wrong with that, right? Some situations, maybe you do just need to go under the knife and have it fixed, right? There's nothing wrong with that. But for them to just be like, yeah, if you don't do what I say, you're doomed. That's a tough sell, in my opinion, right? Like I said, I'm not a huge fan of how that was handled. This person clearly illustrated that they were wrong. Does this person have a superhuman way of dealing with things that most people would not? Yes, absolutely. And this person might be the exception to the rule, where again, those surgeons might have seen 499 people in this exact same situation where they weren't like willing to do that extra work. And maybe the surgery was the way to deal with it. And this person's just a 1 in 500 who was like, I'm willing to do whatever it takes myself to fix it. And I love that. I think that those people are great and they have great stories to tell. And I think it's really important that they get these stories out, because it goes to show you that with some patient education and patient empowerment, it's possible to fix a lot of situations, right? And I think that in America's medical system, especially today, there's a total lack of patient empowerment. I think, personally, where you see a lot of these people who get caught up in the hubbub of daily living, that they forget that they can also take care of themselves. And, there's a lot of medical situations that could be handled a lot better if they didn't just kind of go through their life not understanding how it works. There's some accountability there. Do people get super busy and they can't necessarily take care of themselves because of all the things that they perceive as super valuable in their life? Absolutely. It's not necessarily your fault, but it is your responsibility, in my opinion. You got to make time for movement. You got to move. You got to exercise. Your body was designed to do it. If you don't do it, if you do not make time to heal, your body will make time to heal. And that's when you'll be stuck on a couch. And it's not fun. Exercising can be fun. If you find exercise that you really enjoy, go do it. If you don't, it's going to be a heck of a lot less pleasant when your body decides that it can't take it anymore and it does it for you. And that's how I usually tell people. It's like, you could do this the easy way or you could do it in the much more difficult way. And it's not about fear. It's about understanding what is happening. Anyway, I went on my high horse there. Sorry. I might have gone on a weird rant. But yeah, let's talk about these MRIs real quick. These are I think it's a T2. Again, this is the one where the water's white. I think it's T2. Pretty sure it's T2. I did not look it up. I could look it up right now and not make myself look like a doofus, but I'm pretty sure it's T2. I'm not going to look it up. If I'm wrong, I'll put it up here because I'm a silly Billy. Sorry for using that language. Anyway, but if you look at the lateral, which is the one on the far left, lateral just means you're looking at it from the side. You can see that there's a lot of liquid going on inside the bones themselves, which is kind of interesting because that goes to show you that the bones themselves are going through some kind of modic, as we talked about last episode, where there's blood in the bone itself because it's trying to change in a way where it can help facilitate the healing. It's not necessarily a good thing, but if you look down there at the L5S1, I'll probably highlight it. I'll probably put a little highlight on there. You could definitely see that the disc itself is bulging out. That's a pretty severe bulge. That sucker's pretty big. I could definitely see why surgeons might say, hey, you're doomed if you don't take care of this. That's a pretty big one. And you can even see that in the the posterior area, that the bones themselves are, they don't look happy. We'll just put it that. There's definitely some extra liquid going on in there that probably should not be there, whether that's blood or something else. Hard to say. It's probably blood just because of, again, like I like to talk about modic changes. If you look at the transverse cut, which is the one where you look like, in this case, would probably be from the bottom, so you'd be looking from the bottom up. Again, I'll highlight it. This is the spinal canal, and you can see it kind of looks like it's a little cattywampus there. It looks like it's kind of crooked. That goes to show you that there is a bulge. That is an undeniable bulge for sure, and it is pushing to there is a left or right on this. Usually when you're looking like straight up, I want to say that that's the left side. I think it's pushing to the left. I want to say that I think he said that it was going out to the right though. Yeah, he says in the text part that it is going out to his right leg, so that's probably the right side. I don't know if there's actually like a marker here. Usually you're supposed to put like a marker, at least on X-rays, you're supposed to put like a marker. You put it on the bucky, and it'll tell you left or right side. I don't look at MRIs all that much, so the protocol on that I can't tell you for certain what it is. So I'm not an MRI expert, so I apologize. I'm getting a lot of MRIs here. I'm learning things. It's so much fun. And so anyway, but yeah, that's undeniable. Even me as not an MRI specialist, I could tell you that that's a bulge right there. It's hard to deny. And then when you look at the close up of the L5S1, S1 means sacrum. So the tailbone, again, I'll probably put a little highlight on there, but it's kind of like one big bone. It's not necessarily the case. There's definitely some micro movements inside the sacrum, but that's a whole nother discussion for itself. There'd be a lot of people that would say I'm crazy for saying that, but it's not crazy. It's true. I hate to break it to you. As much as you want to tell me I'm wrong, I'm not. The arrow's pointing right to it. That's a nasty little bulge there. And because it's going out and touching that white, like I'm gonna call it a river situation, that white river is your spinal cord. So if that's getting touched by the disc should not be touching the spinal cord like that for sure. That's what's causing that sciatica type symptom. How that happened, again, he didn't really fully say. If I had to take a lucky guess, he probably fell on his butt, would probably be my guess, or he did an improper lift, but he said he wasn't doing it at the gym, so he might have been at work, or he might have been like, again, it's always socks. He bent over to pick up a sock. That's always what it is. It's always a sock. I don't know why. It's very consistent. But anyway, then we're gonna do a little time skip. We're gonna go 11 months into the future. Hi, it's me, 11 months into the future, Dylan. Hi, it's me, it's Dr. D from the future, and I'm here to tell you all about this MRI from the future. So if you look at this, you can see that it looks a hell of a lot better. It looks a lot less aggressive, especially up here in the L2, 3, 4, 5, or the 5 area still looks like, still some funk going on there. But L4, 4, 3, 2, they look a lot better, for sure. There's a lot less anger going on in the back of those vertebrae. I would be kind of curious to know what that is, because it's separate from the spinal cord itself. itself, I would guess it's a modic change. I actually am not entirely sure what that is. But the, AOL and the PLL and all that look pretty good. I'm losing track of what I'm talking about. Yeah, if you look at it, that bulge is definitely not as nasty looking for sure. There's still a little bit of a bulge there and a little bit of what they call an anterolisthesis from the sacrum going forward, which just means that the sacrum itself is starting to slip forward. I wouldn't necessarily go as far to say it's a spondylolisthesis. And some of those words I used might have been wrong, kind of like thinking about it now, but there's definitely what they call an anterograde movement of the sacrum, which just means that it's sliding forward and the disc itself has to stay attached to the sacrum because it is bolted onto that sucker. So in this case, it's still attached. The bulge is not nearly as nasty as it was before. This person probably, like they were saying in the thing, significant amount of relief just not having to deal with that all the time. Again, if you look at the transverse cut, significantly more in the middle. It is where it should be. It's not having a little vacation to the left or right. It still has a little bit of funk going on towards that right side. He said that he still experiences pain a little bit, but that's definitely better. That's a lot of healing that's going on there. And then if you look at the close-up of the L5S1, it's definitely not nearly as bad. Again, I would be curious to know what they would do. This person probably should still go to PT just to get that sacrum to come backwards. That might be a little bit of a anterior pelvic tilt kind of situation where it might be a good idea to start doing stuff like back planks. Regular planks are good. I would probably throw in a side plank too. You might as well just throw all the planks in. Do the full circle. Do the thurkle plank. The plank of the thurkle. And that should help stabilize that area. And then anything that he can do to strengthen his glutes and make sure his hammies and quads and all that are nice and stretched out so that his glutes and his core can do their job. And then make sure you work out low back. A good trunk lift would probably be really nice for him as long as he's got good form. Even a Nordic trunk lift. I feel like that's not the technical term for it, but there's a Nordic version of it where something just holds down your legs and then you do like you do an uplift through the leg itself, like almost by where the knee is, as opposed to hinging on the low back. That might serve this person a little bit better, especially if the low back is still pretty sensitive. And then I think any kind of good decompression to the low back is probably going to be marvelous. When he was doing those pull down type movements, again, I think that is a good indication that he just wants traction, which just opens up the low back and probably lets the goo just go back to where it's supposed to be. It probably feels really good. There you go. So yeah, that's pretty much how I would go over that. I'm not sure if there's anything in there that I could kind of talk about more. That would be a chiro patient to me. If they came in and they said, hey, here's my MRI, I'd be like, all right, great, let's start doing stuff. I would probably recommend that he would also be going to PT, or even if he came to chiro just for the initial pain symptoms until he could start moving again better. Whether or not he would need the shot would kind of be a point of discussion, right? So if we started treating it and he's like, oh, I'm feeling a lot better, but my MD offered to do a pain shot, I'm kind of thinking about doing it. I'd be like, go ahead. Just go ahead and do it. Go get your relief. Then we could start talking about getting your movement back in there. What does that look like? Kind of depends on the situations. Do things that feel good. Don't do things that feel bad. I think it's Belichick for the Patriots, the Pats. I'm not much of a football guy. He said something along the lines of like, do more of the good stuff, do less of the bad stuff. I think that was Belichick. There's definitely a coach that said that. I don't remember exactly who. I think it was him though. Don't skewer me. I'm not a sportsman. I'm not a sports ball player. I'm sorry. I just helped them. So there's just kind of something to kind of keep in mind. What feels good is probably good. What feels bad is probably not good, at least in regards to physical movements. So go ahead and just keep that in mind. Okay, let's do some comments. Look at this guy. This guy's even responding to people who talked in his thing. That's fantastic. That's fantastic. Okay, so this is the OP, the original poster. He is responding to another comment. The original comment is congratulations, and I'm not going to copy that just to keep it easy on editing. Congratulations and well done. Quick question. Did the big three really help you? I am too scared to do them in case it makes it worse. Thank you. That is called fear avoidance. Super important to make sure you conquer that. You do not want to not move because you're scared of hurting yourself. You've got to move. You have got to do something. Don't sit around. It will only make it worse. Find the movements you like. Do them. Don't avoid. Movement is important. Don't put it to the side. Just please. Please, please, please. Listen to that. So I will give you a few directions on doing, and then this is the OP, the person that started all this. So I will give you a few directions on doing the big three exercises that would generally be valid for every other exercise you might want to do. Listen to the feedback your body gives you. Thank you. If something you do is not okay, you will most certainly feel it. If a given movement or exercise is causing harm, you will feel pain from it. Once you get that feedback, stop and reassess what you're doing and apply corrections. Maybe retry at a later point. Couldn't. It's literally what I just said. Thank you, OP. Big fan. I'm a big fan of this guy. Big fan. Open YouTube and watch a few videos on how to do a given exercise if you are not sure. Try it. Maybe even do a video of it yourself. Yep, you could definitely record yourself to see how you look, and then watch it and be your own judge on your form. The big three and other similar exercises aim to strengthen your core. The point is that a stronger core equals less movement at the problematic discs, which equals less friction, less pain, and less inflammation. Boom. Love it. In general, try stuff out carefully, carefully in this case, and see how it goes. That's literally what I just said. Just do what I just do as I say. Do as I say. Again, this is another one where the OP is replying to another comment. The original comment is, "This is awesome. Thanks for sharing. I have a similar story. I wanted to ask how you got the referral to do the second MRI, or did you do it out of pocket?" The OP responds with, "Where I live, my insurance covers the MRIs as long as there's a reason for one, of course. Since I had the first MRI showing a serious herniation, I had no issue doing a second one to follow on the condition, basically to see if it was better or worse." So that's an interesting thing. Insurance, when you really boil it down, and I'm going to say this, and I'm totally biased, so I will just state my bias at the very beginning. I think insurance is evil, and I think it's one of the worst things that's happened to the American medical system. Not because of essentially what insurance could potentially stand for, but the American insurance system is vile and disgusting, and they are the worst. They are absolutely the worst. Have people benefited from them? Yes. Have people been helped by them? Yes. Do they take advantage of tons of people and deny claims and all that for people who actually need care? Also, very much yes, and I hate them. So insurance companies don't come at, I hate you. I absolutely despise you. Anyway, got a little passionate there. Where I live, my insurance company, I'm sorry, I just read that. So yeah, anyway, it's not always possible to get MRIs without some kind of like hurdle or some kind of hoop you got to jump through. Some people just can't get MRIs at the very beginning, either because the insurance denies it because they don't think the symptoms you're suffering are serious enough, which is a realistic thing. MRIs are very expensive. They require a lot of electricity, and they don't want to be used needlessly because they're very expensive for everybody involved. And a lot of times it'll give you information that's really not all that necessary. It just kind of gives the patient a little bit of peace of mind. And there's a lot of patients out there who want to be treated on a superlative type of way where they get the most expensive stuff because they think that that'll improve their outcomes. I don't think that's the case. In this situation, I think getting a second MRI, especially for a disc bulge that bad, I think is probably warranted just to see if that person still is like a surgical candidate. I think because there was so much discussion of getting a surgery, I think that MRI probably did warrant being, I think it was warranted getting it because again, it showed a lot of improvement, and it means that he's probably being taken off of the list for somebody who should be getting surgery. So I think it's warranted, but not everybody's going to be that lucky. He's lucky in his area where his insurance is a little bit less unhelpful. I guess. Leave it at that. Okay, I just found some gold in the comments section. Oh man, I'm so glad I found this. Yes. Anyway, there's a little bit of a discussion here, and then at the very bottom, it actually tells you how he injured his back, and lo and behold, I was right. I'll probably read these a little quick fire and then just kind of have a discussion over it. This is what I keep telling people. Low back issues come from not enough curve in the low back. Just look at how, I'm assuming they meant to say bigger. The curve is after you did all that proper exercise and minding your back, you still need more curve in it, as most of us just look at weight lifters. I feel like is this the same guy? Because there's definitely been comments where people are like, you need more low back curve. Person underneath it, hi buddy, I have a nice big curve in my low back and it's actually keeping me in debilitating pain for 3 months now. The lower back issues I have are also because of this curve, so I guess it depends from one person to another. The answer is yes. You do not necessarily need a curve of a certain size, but we'll get to it in a second. Next comment, you can indeed see a difference in the curve of the back, and this is also the OP, by the way, the original poster. You can indeed see a difference in the curve of the back in the before and after images. However, I'm not sure if this isn't just the result of the muscles being relaxed because there is no pain anymore. So basically the absence of pain fixed the curve, not the other way around. Not a specialist, so can't tell for sure. Yeah, that is also my understanding of how the curve in the low back would kind of work in his situation. That discussion of weightlifters having a certain kind of curve to their back being a good or a bad thing, I think it's a pointless discussion. I don't think the curve really has that much to do with it when it comes to like a certain amount. Like if you have a totally straight spine, that's not necessarily good, especially in the neck. I feel like the curve discussion kind of comes up more in the neck than it does in the low back in regards to like pain that can't just be controlled by doing good core and back exercise type stuff. There's a little bit more of a discussion if there's somebody who has like what they call a sacralization or a lumbarization, where they either have an extra or one less lumbar bone. That's another discussion in itself. There is something to be said about it. I don't think curve is as important as some people really seem to be pushing, and I'm a curve and spine doctor, so I feel like I have a little bit of say in the matter. I don't think it's as big of a deal as people tend to make it seem. I'm sure there's research out there that proves that I'm wrong, and I'm sure there's research out there that says that I'm right. Whatever. That's my personal opinion. I just say the curve is not really something you can really totally control unless you're talking about like pelvic tilt, in which case, as long as your pelvis is nice and level and you don't have pain while you're doing it, just maintain, do core exercises. And anyway, person underneath it, I can assure you it's not. I had no pain, just did an x-ray for other reasons, and my doctor said my lordosis is straightening. It looked like yours. It was due to a fact that I had a very hard manual labor job with a lot of bending, and it's hard to maintain proper form and muscle tension all day. Same happens with people who sit a lot and stand a lot. I know a guy who was a chef and he had a bad disc pending surgery like you, and even poorer curve than you. One would say, how is that possible with him not doing any extreme sporting activities, and he was on his feet all day and walking every day with his dog? It's because we need to maintain proper spine curves, neck, thoracic, lower. It's funny, neck, thoracic, that is also spelled incorrectly, and lower. Something about it. He kind of like went in and out of medical terminology there. It's kind of funny. Anyway, throughout the day, and it's not a hit on him. I just thought it's kind of like saying one and then saying B and then going tertiary. It's like kind of like saying it like that. Throughout the day, and you need proper balance of muscles and coordination to do that, and that only happens by doing what you did, rehabilitating yourself with proper combination of exercise and minding your posture throughout the day. Unless you are one of the lucky people who develop proper posture early in their life, you edit. Also check out the how and the second image of the L5S1 fit together are in better line. Still not perfect, but getting there. By the way, can you tell me how you got the injury? That's what I kind of actually want to get to. Yeah, this guy sounds like he has like I don't know. It sounds like they're getting on like a high horse. They're being like, you got to do what I say because it's right. What if we have a situation where somebody does improve their spinal curve and they don't get better? Well, then where's your discussion point then? I don't think curve's all that important. I'll just leave it at that. But yes, I do agree. Rehabilitating yourself is super important. That part I agree with full-heartedly. Here it is. Here's the OP. I injured myself in a very dumb way, actually. I fell directly on my tailbone from a water slide. Man, the pain was so sharp, excruciating, and instant. I remember it like it was yesterday. Thank you for the rest of the info. Everything sounds reasonable. I was right. He fell on his butt. Yes, my doctoring skills. Yes, I did it. I'm the best. I'm the best chiro ever. Yes. But anyway, yeah, there's more comments and all that below here. There's a lot of people talking on here. There's probably a lot of really interesting information in here, but I got things I got to do. So yeah, anyway, yeah, that's a super interesting case. I'm really happy I read that one. I hope you guys got something out of it. The MRIs show the story on that one. That's not always the case. There's usually some situations out there where you take an x-ray and MRI, you don't really see anything, but that was definitely like a black and white. Hey, here is your disc. It is not where it's supposed to be. It's not happy. And you feel better when it goes back. That's as black and white as you could hope for in a medical situation. And I'm really, really happy that they're feeling a lot better. And I have a feeling that with this guy's empowerment, again, talking about patient empowerment, I really think that he's going to be pretty well off. And I'm really excited. I'm excited for him, even though I'll probably never read or hear from him again. Dr. D mentioned you, so reach out and we'll talk. We'll hang out. We'll go get a coffee down to go watch a Bruins game. Thank you very much for listening to this one. This was definitely this is a more complicated question, and I love the story, but I think from soup to nuts, I think it was an awesome situation, and I'm happy to see that my doctoring skills are pretty much supported by everything I just read. So thank you very much for listening to this. Dr. D out. I hope you guys keep it popping out there, and I'll talk to you guys next time.